Alright, I'm going to be demonstrating a little bit of how to learn and memorize things using pictures. And I really don't have anything prepared for this. It's just going to be off the top of my head, so you're going to see how this process works. So, renal vasculitis. First thing in here with renal vasculitis that we're going to be doing is going to be granulomatosis with polyangiitis, also known as Wegener's syndrome. It's granulomatosis. Let's see here. So we're seeing granulo. I'll probably use a granny for that. I'll use a wagon for that. Vasculitis. I don't know what I'll do for that one. I'll figure something out. Cianca. That seems like a big deal. Remembering that Cianca is proteinase 3. Okay. Lungs and sinuses. Saddle nose deformity. That'll be fun. Ocular disturbances. Whoa, that was an accident. Where was I? Hold on here. There we go. Ocular disturbances, nervous system symptoms, whatever. Crescentic glomerulonephritis, venous thromboembolism, elevated erythrocyte sedimentation. Okay, so this doesn't have to include everything, but it's just a good way to get the main stuff down. So the first thing I'm going to do here is I'm going to draw a wagon. So there is a wagon. Yep. There's the tire thingies. And so that's the way I'm going to get Wegener's down. Now, how am I going to remember that this is associated with granulomatosis? Well, I'm going to have Granny here sitting on the wagon. So, going to be kind of bent over. She's got that kind of old lady hair and the nose thing going on with the mouth. There's the old Granny. She's got her little cane. Okay, so there you go. And, oh, man. And, okay, so there she is, the old Granny. And she's sitting here. And I'll do some eyelashes so you can tell she's a granny. There she is. So granulomatosis. So wag. And that's the wagon. And this is the granuloma. Okay, so that's the granny. Okay, so now I need to know this is a Cianca. So for that, I'll just draw on the back here. It's the C. They're coming out of the C. This wagon's out of the C. And what do they have coming out the back? They have this anchor with the letter C on it. That's their letter Cianca. So Cianca. And ocular disturbances. Maybe for that, I'll make this here have like really creepy purple eyes or something like that. Disturbing eyes. Ocular disturbance. Maybe they shoot out laser beams or something. I don't know. Ocular disturbance. Okay, saddle nose deformity. So maybe for that, since her nose, I can't really see it, I'll just have to like draw a weird looking saddle that looks like a nose or something. So she's sitting on a saddle nose. That's a nose, right? There we go. So saddle nose. That doesn't look like a saddle nose, but it doesn't matter because I'll remember that the wagon and the saddle go together. Saddle nose deformity. Oops. Nose. There we go. Crescent. What does she have to eat? She's got a bunch of crescent rolls here. And that's what she's got to eat in her little basket thingy. So crescent. Crescentic. Nervous system okay, so I'm gonna how am I gonna do that? Maybe I'll have her be all shaky. She's all shaky because she's nervous. And yeah, that's pretty much most of them. I didn't do polyangiitis. I guess I could do a bird up here. Polly the parrot. Polly want a cracker? There it is. There's the bird. Look at the little legs, and little beak thing here. That's Polly. Polly the parrot. Doesn't look anything like a parrot, but whatever. It's okay. Get the idea. There's the first one. Next one here. Churg-Strauss. Granulomatous. Vasculitis. Okay. Sinusitis, skin lesions, purpura. Asthma looks like the big one here. Okay. Churg. Okay, so here's what we got going on. This guy right here. He is chugging. He's chugging some straws, or yeah, maybe some straw, like some nasty stuff. Okay, so Churg-Strauss. Chug straw. There we go. He's chugging the straw. What happens to these straws? They go down. They get wedged in his throat like this. And that gives him, here's another color, asthma. I mean, that happened to anybody who chugs straws, right? Oh, red eyes. That was an accident. Anybody who chugs straws is going to get asthma. So this guy's got bad asthma from chugging straws. What else is going to happen to this guy? Well, he's going to end up peeing out. He's going to pee out the straw, so Polyangiitis. So there's a bunch of pee coming out. Polyangiitis. And maybe we'll have this anka. Probably should have drawn him. Here's what I'll do. Polyangiitis. He's chugging straws. Here is his leg up here. Ankle. So that is P on ankle. So Polyangiitis. Chugging straws and he pees on his ankle. Oops, that was supposed to be an explanation of what it was. A-N-C-A. Polyangiitis. Okay. I got to remember that myeloperoxidase, like this other one too. I need to somehow remember that C-ANCA is proteinase 3. So C-ANCA, maybe what I'm going to do here is what's high in protein? Fish. So I'm going to draw 3 high in protein fish. 3 protein rich fish around the C-ANCA. So proteinase 3. So there we go. Now this one, myeloperoxidase associated with that. So what I'm going to do with this is I'm going to have some hydrogen peroxide and it's P. It's Polyangiitis. Myeloperox. And maybe he's saying this is a natural peroxide for cleaning wounds on his ankle. He's got a wound here, so he's trying to use his pee, chugging straws, trying to use his pee to cure his wounded ankle, but chugging the straws is giving him asthma. And maybe this eosinophilia is because he is afraid, or maybe he loves blood. Eosin is like blood. So I'll probably put down here eosinophilia. Eosinophilia. And of course, if you were to chug straws, you're going to get a bunch of really nasty GI symptoms. So GI symptoms. Okay. And purpura. How am I going to remember the purpura? Maybe it's because on his glass he has a picture of his kitten. The purple kitten, called purpura glass. Purpura. This is purple kitten. Okay, so yeah, sure, that'll work. Purpura, purple kitten, purring kitten glass. Anything else on there? Peripheral neuropathy. Maybe you could think of this here as being kind of peripheral and it's neuropathy. I don't know. I think I got most of the stuff on there. Okay, next one. Microscopic polyangiitis. So, microscopic poly. So maybe what I'll do for this one is I'll draw lots of little tiny polys. Poly birds, little tiny birds. Microscopic poly. Well, that was a terrible looking bird. There's all these little polys. Microscopic poly. Small vessel vasculitis. That's easy because these are small. Small vessels. No granulomatous infection. So, sign here, no grannies. And the birds all like to sit on this sign. All the little micropolys like to sit on the sign and they poop on it. Lesions involve capillaries, small, medium-sized vessel, and P-positive ANCA usually. So these birds, they're peeing. They're peeing on the ANCA. So P ANCA. I don't know, somehow I've got to draw an ankle out here or something. ANCA, or an anchor. Of course, I used anchor for the other one, so I better draw the ankles on this one. So I don't know why there's ankles out here. For some reason, there's decapitated ankles out here. And they don't want grannies to go out here because it'd be too scary for the old grannies. They might have a heart attack. But all these birds are peeing on these ankles. Creepy. Okay. Whatever. It works. No grannies out here because it's a nasty, scary place. That's really nasty. Okay. Yep, that's pretty much good for that. I'll remember that. Polyarteritis nodosa. So now we've got another poly. It's not a micropoly. This is a poly. Micropoly. This is a polyart. Poly. Okay, so for this one, polyartist, we're going to have a poly here. And this poly is going to be kind of an artist poly. So let's draw that thing going on here. And got those weird French hats on. So there's our artist Polly. There's that paint thing they use. And okay, so this is our Polyarteritis, nodosa. So there we go. Fibrinoid. Oh, so black stool. So got some nasty black bird poop back here. That's the stool. Black poop. He's been on a bad diet. Fever. So maybe what I'll do for the fever is have a, yeah, sure, have a little thermometer coming out of his mouth there. There we go, so fever. Myalgia is hypertension. So for the hypertension, we'll do a little blood pressure cuff on his arm to show that he's super hypertense. Blood pressure. So there's a blood pressure cuff. Hypertension. Myalgia. Maybe what's happening here is the painting he's working on. Could be, well, there's a couple things I can incorporate that, so maybe I'll hold on to myalgia for a second. Neurologic dysfunction. Maybe he's kind of crazy. Hepatitis B. Hepatitis B. Hep. That seems like a big deal for this one. Hepatitis B. Well, hepatic, that's a liver. So maybe what he's drawing here is a liver. And he's having fun with this liver because it's being devoured by bees. Hepatitis B. Hepatitis B. Aneurysm dilation. Aneurysm. Okay, usually when people talk about aneurysms, I think of stuff going on in the brain. So something weird on this guy's brain. Medium-sized arteries only. Guess that's a big deal. No glomerulonephritis. So we'll have let's see, how can I do the no? I don't know. I think that's enough. Okay, next one here. Cutaneous vasculitis, hypersensitivity vasculitis. Cutaneous leukocytic angiitis, idiopathic cutaneous vasculitis, skin biopsy, palpable purpura, look for drug reaction, infection, or other disease. Treat with steroids, idiopathic, badapsone, colchicine, hydrogens, less toxic. Okay, so cutaneous vasculitis. So cut the vascules. Okay, so what am I going to do for this one? I'm going to do an idiot because idiopathic. Gosh, what the heck? There you go. That is really giving me a hard time. Okay. So I've got an idiot here, or idiopathic. I don't even remember what idiopathic has to do with this. But he's a crazy guy, whatever, because he's got a knife and he's going to cut people. So cut, cutaneous, cut. What is he cutting? He's cutting blood vessels. Leukoplastic. Oh, maybe he's leukocytoplastic. Maybe he's Luke Skywalker. So on his other hand, what does he have here? He's got a lightsaber. Clearly, I'll keep that. Whatever. He's got a lightsaber. I don't remember what color his lightsaber is, but let's say it's blue. So he's Luke. Luke cuts the vascules. Palpable purpura. Well, maybe Luke got some weird purple things going on. Some kind of alien zit thing. I don't know. Palpable purpura. I get a little skin biopsy here from him. His hand got cut off. That's a nasty chunk of his hand that got cut off. Skin biopsy. And what is leukocytoclastic angiitis? Leukocytoclastic angiitis. Whatever. What else do I need here? I don't know. That's probably enough. Dapsone, colchicine. Seems like you treat all of them with colchicine. Hydroxychloroquinolone, maybe less toxic. Whatever. All right. Cryoglobulinemic vasculitis. Ooh, there we go. Cryoglobe. So somebody's crying on the globe. So here's a globe. Okay. And they're crying on the globe. So these people, for whatever reason, crying on the globe. There's a globe. You get the idea. I don't have to do this in color for it to work, but it's fun. Okay, so this person crying on the globe. There you go. Tears. So, globe, cry. Hepatitis C is palpable. So what I'm going to do here is, this is a really special globe because right here in the C, you actually have a liver in the C, in the globe. You got to tie it into what you're talking about. So there in the C on the globe, hepatitis. This is the hepatitis C. Why is this guy crying? He's crying because he is cold, and that's why he is crying. So he's cold. So here's a box of tissues, and he's got tissue here. He's got a cold. He's got a cold because he's got tissues. He's crying. He says, I just have the cold. That's why I have these tissues. So arthralgias. Maybe this guy is actually King Arthur. He's crying because he just found out the world was not flat. And that was really sad to him for some reason. Arthralgias. Arthur. Arthralgias, glomerulonephritis. Glomerulonephritis. Glow. Maybe the weird thing about this guy too. He's got creepy glowing. He's a glower. Glomer, whatever the heck, I don't know. That's kind of creepy, right? Glow. When he cries, his eyes glow. I don't know. Alright, next one. Drug-induced vasculitis. So, clearly we're going to have some really sketch guy on drugs here. Well, that's a weird looking guy. Okay, so is this druggy guy? So there's our druggy guy. Druggy. And let's talk about this druggy guy. Well, for one, he's got weird palpable purple things all over his body. He was trying to steal some gold to support his drug habit. And also some drugs, but he smelled so badly of sulfur that people were saying, oh, it smells funny. Stands for phenytoin. Let's see. Hydralazine. Well, this guy really needs to get hydrated, so he gave him a glass of water here for hydralazine. Hydrated. Yeah, allopurinol. So this guy was trying to do drugs, and he thought maybe he could smoke some aloe vera, and it didn't work as well as he was hoping. Allopurinol. I think that's the last one. Yep, it's the last one. Alright. Hope that was enjoyable.